Inviting us. All right, so first off, we want to thank everybody for inviting us here to speak today, to share some information. And, I think like many clinicians that you speak to, when you first come in and you say, I have inclusion body myositis, they probably say, what's that? And that's what I did when Linda came in. I said, I'm familiar with myositis. I'm familiar with clostridiomyositis and other types, but I didn't know anything about IBM. And when she said she wanted to treat with hyperbaric, I said, I want to make sure there's a study out there that shows there's a benefit for you. Let's look at the disease progression and see if it makes sense. If it makes sense, let's do a short series of treatments. If you have some results, then we'll continue. But I don't like to throw things at the wall just to see if they'll stick. So we put together a very short presentation. The presentation focuses mostly on what hyperbaric oxygen therapy is. We're going to get into a case study that was published about inclusion body myositis specifically. And then I'm going to let Hannah take over and talk a little bit more about, Linda's specific case and what we noticed and what we charted there as well. So I'm going to go ahead and share my screen here with our presentation. All right, so as I share the screen, I'm going to hope that you guys can also see me as well with this, because I think it's just a little helpful. So let's see what that looks like. So hopefully everybody can see at this point. So our presentation here is hyperbaric oxygen therapy and myositis. I didn't put it only on inclusion body myositis because the body of literature just simply is not there. So we're going to be looking at a case study specifically on inclusion body myositis. However, let's talk a little bit here at the beginning about just really what is hyperbaric, a tiny bit about myself. I am board certified as a lifestyle medicine physician. Why lifestyle medicine? Well, I was involved in a significant injury during my training, a series of 7 surgeries, talked about amputation multiple times, and I couldn't continue in surgery as in my training. So I went ahead and did something where I didn't have to touch my patients, preventative lifestyle medicine. I am a certified trainer for the International Board of Undersea Medicine, the medical advisor to the National Hyperbaric Safety Association, a number of other groups here. You're going to see the Arizona Naturopathic Medical Association down there at the bottom. I'm not a naturopath. I believe in their principles and what they do. My primary care is a naturopath. So it's something that I believe in a lot, and that's why we're so involved with them. The bottom right there, you'll see the International Hyperbaric Association. I am a faculty member, and we'll be presenting at their meeting this year as well, so we can share information there. So like most people tuning in, the first thing you're probably thinking is, what is HBOT? Guys, it's actually very simple. It's oxygen plus pressure. So there's a medical definition from UHMS, a big society that says, well, you have to be breathing in 100% oxygen at a pressure greater than 2 atmospheres absolute. It's a pretty tight definition, and I may not fully believe in that. That's a new definition as of 2024. Prior to that, they said less pressure would be considered hyperbaric. My belief is oxygen plus pressure, and we'll get into why we discuss that. So why the pressure? Why can't I just sit here and breathe oxygen and get a result? You have to remember that your red blood cells that carry oxygen, they're carrying about as much as they can at all times. Typically, they're saturated. And I'm sure at some point, you've put on a pulse oximeter on your finger and looked at it and said, oh, 95, 96, 98. 98% of your red blood cells are carrying as much oxygen as they can, and we can't get them to carry any more ever. Yeah, we could go do what maybe Lance Armstrong did in high altitude training or blood doping or something to get more red blood cells, but you're never going to carry a significant amount more. But when you add pressure, you dissolve oxygen not to your red blood cells, but into your plasma. It's like making soda. Your plasma can carry 1,200% more oxygen, and it's not bound to your red blood cells, so it's freely available, and it goes directly into tissue. The pressure we use directs the tissues and the growth factors we talk about. So that's Henry's law that dictates that. Henry's law is how you make soda. It's how we make soda out of your blood. So if we look at your oxyhemoglobin, your red blood cells right here, right now, they're carrying roughly 19 milliliters of oxygen per 100 milliliters of whole blood. And if I give you 100% of oxygen without changing pressure, I can take you all the way up to 20 milliliters of oxygen. And if I put you in the chamber at 100% oxygen at the highest pressures we treat at, we don't carry any more oxygen in our red blood cells. They're saturated. So when we look at our plasma, that's where we see the change. So our plasma is carrying 0.32 milliliters of oxygen per 100 milliliters of blood. If I give you 100% oxygen without changing pressure, that does go up. But when we add pressure, that's where we see that 1,200% increase, 6.81 milliliters of oxygen per 100 milliliters of whole blood. And you have to remember, your body's primarily water. The water of your body is plasma. So there was a study done back in the 1950s. Dr. Ita Boromea, who used to do surgery inside of hyperbaric chambers, said, how much oxygen can we get into your plasma? So he took pigs and fully exsanguinated, took every drop of blood out of them, filled them back up with IV fluids, put them in the chamber at 3 atmospheres, and they lived. They lived the entire time they were in the chamber. They exchanged the IV fluids with blood when they brought them back out, and the pigs lived afterwards. He was the first person to recognize that we were able to provide enough oxygen for your body at rest so you don't need any red blood cells. His study's called Life Without Blood. It's a great read. It's actually very short. And it's just kind of a fun concept to think about. So you don't need red blood cells. Well, okay, yeah, you do. But if you lived in a hyperbaric chamber at high pressure with 100% oxygen, you might not need red blood cells, but you can't do that. You can't stay in chambers for extended periods of time. Now, how much pressure do we need? Everybody thinks more is better. Every patient I've ever spoken to that comes in the door says, well, what's the highest pressure you can treat at? That's where I want to treat. Guys, there are benefits at every pressure, and those benefits vary along with the pressure, as do the adverse events. So as we look at low pressure, mild hyperbaric oxygen therapy, it's not something we do here in our facilities. However, there are some studies now showing a benefit. So the benefit can be increased circulating stem cells, maybe up to 2 to 3 times increase. However, that's a very small increase in circulating stem cells. It might sound like a lot. I'm doubling to tripling the circulating stem cells, but if you get a swift punch in the arm, you increase your circulating stem cells. But there is a benefit, and that was with hyperbaric air, not even using oxygen. Now, those mild chambers, the one that's on the right here, it's by a company called OxyHealth. And the reason we show that one specifically is because there are FDA-approved, pressure-tested, mild hyperbaric chambers. They're still expensive. If you're finding chambers online for sale, very reasonable compared to everything else you're looking at, chances are they're not tested. We didn't put the video in here, but we have a video recently of one of these mild chambers exploding just due to a poor zipper. Don't get into a chamber that hasn't been tested, no matter how reasonable the pricing looks on that. So 1.5 to 2 atmospheres absolute. It's actually probably the most common treatment pressures for off-label indications, for indications that may not be insurance-based or hospital-based. The vast majority of my patients probably treat at this range, unless we're talking about surgery or trying to get into bone. But at 2 atmospheres absolute, we can see an 800% increase in circulating stem cells. So that 2 to 3 times doesn't sound so good anymore. We also can increase the length of your telomeres. If you're not familiar with telomeres, it's the ends of your DNA. Your DNA gets a little bit shorter and a little bit shorter every year. So when you go out and commit a crime and leave some DNA at the scene, they look at the length of your telomeres to see, oh, it's a person roughly at this age. So with hyperbaric, we can actually increase the length of those telomeres, protecting our DNA. We have a huge number of peer-reviewed research journals or publications proving these mechanisms. So as we look at those mechanisms, we have proven mechanisms primarily at 2 atmospheres and above. I do have research below that as well. The mechanisms that we talk about, the very first one, vascular endothelial growth factor, growing brand new blood vessels. This is a benefit for every single person. Our blood vessels age. Every one of you has gone to your cardiologist and they talked about your calcium index score. It's just like your plumbing at home. You go pull out your plumbing, you look inside, and inside of it, there's a little bit of buildup inside. Well, that's calcium inside of our blood vessels. Brand new blood vessels take time to grow calcium. It's a great way to protect your body by just growing brand new blood vessels. The next one, platelet-derived growth factors. Everybody here's probably heard about platelet-rich growth factor or platelet-rich plasma, PRP. You might have seen it that people are using PRP for, anti-aging with the vampire facial, but we see it in sports injury all the time. We see it in inflammatory joint conditions. Growth factors from your platelets have an amazing ability to recruit other cells and help reduce inflammation. Definitely will play a role in what we're about to talk about here with myositis. The next one's fibroblast growth factors, a little bit more about wound care. However, we have a lot of research on that. Next, we talk about nitric oxide modulation. Nitric oxide is a vasodilator. Let your blood vessels dilate to decrease your blood pressure, to get more blood flow to tissue. Hyperbaric plays a role in modulating that, whether it's inside the chamber or when we get out of the chamber. That next mechanism that we talk about here, hypoxia-inducing factor, HIF-1 alpha, this is probably the reason you're seeing more hyperbaric centers now than we ever have. This was the Nobel Prize in Medicine in 2019. This is the biggest contributing factor to what we understand how hyperbaric works, and we only understand that from 2019. Meanwhile, we've been using hyperbaric in the United States since the 1920s, as research going much further back than that. In fact, in 1962, JFK put his infant son in a hyperbaric chamber at Walter Reed to try to save him from respiratory distress syndrome. So when we talk about toxin inhibition here, we're not talking about general toxins in the environment or otherwise. We're talking about very specific toxins from certain bacteria, a very proven mechanism, and that does lead to one type of myositis, something called clostridiomyositis, but that's not what we're talking about here. Clostridiomyositis is a medical emergency. Somebody has an infection that's destroying their muscles. The next part, stem cell mobilization. I told you guys just a few minutes ago, 800% increase in circulating stem cells. That is a proven mechanism that we see in multiple studies. The telomere lengthening, protecting your DNA that we just talked about is, again, that's very recent. And then arborization. Arborization is allowing nerves to grow, not nerver, but nerves. These are peripheral nerves, and we see that where arborization is the fine branching of these nerves. It's a significant effect that hyperbaric has. We see this a lot for our diabetic patients, but we see it for our other patients that have other types of peripheral neuropathy. So as we look at these proven mechanisms, I always like to come back to HIF-1 alpha, because HIF-1 alpha regulates 8,100 genes, turning on and turning off over 8,000 genes. And we just discovered that in 2019. I expect new research in hyperbaric to be an exponential growth at this point. And we've seen a lot recently. So why do we heal with hypoxia and not hyperoxia? Because in the chamber, you're becoming hyperoxic, more oxygen. When you get out of the chamber, your body says, what is this 20% oxygen I'm breathing now? I want that 1,200% increase I just had. So it kicks off a cascade. That cascade allows our body to recruit cells, modulate inflammation, a huge number of steps, like we said, over 8,000 genes. So looking at that, here are some of the mechanisms. Guys, I could spend a full hour on this picture alone, but I want you to focus on the bottom left-hand side of the anti-inflammation. We're talking about IL-1 beta, IL-2, IL-6. Why those are so important? When you're talking to your doctor about the inflammatory markers that they're looking at and trying to treat, those are the three that come up in research for myositis. Now, you also see COX-2, COX-2. COX-2 inhibitors include non-steroidal anti-inflammatories like ibuprofen. When my patient comes to me and says, I'm in pain, I ask them, well, did ibuprofen help you at all? Say, yeah, maybe it takes the edge off, or yeah, I use it, but I can't anymore because risk for my gut. Well, we know that if ibuprofen took away their pain or played a role, that hyperbaric will as well because we target the exact same enzyme. Now, we upregulate IL-10, probably the most significant thing we're going to talk about here for autoimmune disease, IBM included. IL-10 is your body's natural off switch for inflammation. It tells your body, hey, inflammation's important. We recruited the cells we needed. We need to turn it off. Guys, remember, inflammation's how we heal. Chronic inflammation's the problem. IL-10 is very high in rheumatoid arthritis, lupus, but also in IBM. And when we get to the published studies, we'll look at that. There's a number of other things we can talk about in this picture. We just don't have the time today. So how about hyperbaric and myositis? So we looked at a published article in 2012. This was published in the Undersea and Hyperbaric Medical Society, and you can see that it was through Drexel University, Philadelphia College of Osteopathic Medicine. Yes, there's a hyperbaric facility in there, also University of Central Florida. I like to see big groups involved in this because we have to be careful what research we look at. There's bias in every research. And if I was the only published author on something, I have a huge incentive to say, hey, it works because my bias is towards hyperbaric. I like to find that we have a wide selection of authors. So in this case report that was published, it was a 70-year-old patient, 21 in their 21st year of IBUM of being diagnosed. Everybody in this room right now understands that it didn't start at the day you got diagnosed. Start much earlier. And people misdiagnose IBM and a lot of myositis for quite a bit of time. This patient probably had a much longer history of symptoms. This patient was unable to flex her fingers for the past 2 years, experienced increased weakness in the left hand, difficulty in swallowing. That's something that Linda and I talked about because it's so important that we're able to protect our swallow in this. So the objective data here is this patient's creatinine kinase was 322 micrograms per liter, seeing the normal range tops out about 140. Aldolase at 13.6, obviously doubled there as well. So this patient received 12 sessions of hyperbaric at 2 atmospheres absolute using 100% oxygen. This is daily treatment, and almost all hyperbaric we're going to talk about frequency should be every single day until we see results. This patient had substantial improvements in clinical symptoms, improvement in ability to swallow, and decreased anxiety of choking. I love to see that. In the study, they did show this through a barium swallow as well. So improvements were noted on physical exam, ability to flex fingers, and then none of that had been in the previous 6 months before that. Creatinine kinase decreased to 92 micrograms per liter. So that's at the low end of normal. That's not elevated. Aldolase decreased down to 6.5. Subsequently, this patient did continue hyperbaric and reported a consistent improvement in their symptoms. So I love to see a study like this, looking at that creatinine kinase and those aldolase levels, because why do we need to look at those? Well, just like Linda said, and like many of you here, your doctor might say, I don't know if hyperbaric makes sense for you. Isn't that just for wound care? Well, wounds are inflammation and they can get to be chronic. We treat chronic wounds all the time. Myositis is a type of inflammation. So we look at certain biomarkers of inflammation here. We mentioned IL-6, IL-1 beta, TNF alpha, tissue necrosis factor alpha here are great inflammatory markers that we look at here because they indicate inflammation, altered immune function, which can be autoimmune. Guys, myositis is inflammation. I know I'm grossly simplifying this, but the reality of the situation is that if we decrease the inflammation in these tissues, that we can see histologically here on the right-hand side, that we know that we're going to have a better result for our patients with everything else you might be doing, the standard of care. So I don't want anybody sitting here saying, I'm going to do hyperbaric and hyperbaric only, but going back to that picture, look at, there's that IL-1 beta, IL-6, TNF alpha is there as well. I always like to make sure we go back and look at that. Now, this study is a different study. And why did I bring this study up? It has nothing to do with patients who have myositis. The cohort for this was was a representative of the general population. In our patients in the general population, we have a cognitive benefit. The sham is in dark green, the hyperbaric group's in light green. We have a huge change in aerobic fitness. Our muscles are able to do a better job. Our subjective felt levels of energy are significantly improved. Our post-training recovery, our muscles rebuilding themselves, significantly improved. General satisfaction, absolutely improved. So the reason I brought this up is if we see us in the general population, we're talking about, this is a sports medicine journal. If we're seeing this for athletes who are training, your muscles are being broken down, similar in a way that we look at an athlete who's overtraining. Creatine kinase is what we're looking at. So I like to bring that up just so you can see that there's other studies that we can look at. So we treat a lot of patients with wellness, and this is not on just the myositis side, but I'm willing to bet that as we talk with Linda here in a minute, that she might recognize that there are some other sides that she had a benefit of, because we're going to try to create quantifiable change, but a lot of it can be subjective change too. Cognitive enhancement, yes, we can look at studies and see how that is done. Most of our patients give us a subjective that they just feel like their cognitive faculties are better. I have a great new tool that we're using here. We're getting involved in a study to actually quantify that. We'll have that free for all of our patients because we want to see if there really is that benefit we can prove. Of course, we already talked about that aerobic fitness, the energy, the recovery, satisfaction, the stem cell mobilization. There's not a person here, whether it's Hannah and myself or everybody here on the Zoom meeting, they can't benefit from having their stem cells upregulated. Decreasing inflammation is a benefit across the board, immune stimulation, and the last part of that, mitochondrial upregulation. I bring this up every time because when we upregulate your mitochondria, we get to a point that we have cell turnover. That cell turnover gives us the point where now new cells are already upregulated. We've created genomic change. For the vast majority of our patients, they should not need to continue to treat over time. However, if we have an autoimmune, there's something that's a constant dysfunction that's breaking down, most of our patients will end up on some level of a maintenance protocol. So hyperbaric, we talked about anti-inflammatory, looking at that, protecting your DNA, upregulating your mitochondria, and of course, stem cell mobilization. So for my part of this, I couldn't get too deep into anything, so I do want you to learn more. I do always provide our contact information here. You can call or text us at that number. It is already Saturday afternoon. You might not get a call or text back until Monday. That's my personal email. Please email me. I would love to see that. And then, of course, our website to see more information. So all this information will be available for everybody. Linda can share it. And so something that we wanted to do, and Hannah's going to do a little more information here, but also let me stop sharing so we're back here with you guys. So one thing that we want to do for everybody was we wanted to provide everybody here that was in the training opportunity to have a free consultation with us. The free consultation comes with a prescription for treatment. That's not just for our facility. Guys, we have 2 locations in Arizona. That might not be the best location for you. As long as they're providing hyperbaric with approved equipment using oxygen, it's a safe place to treat. We want people to have access to it. So meeting with me, doing a consult, whether it's over Zoom or in person, and then we'll get that prescription over to you. If you're outside of the state of Arizona, many centers will honor my prescription just simply because of my involvement in the hyperbaric community. If they won't, we'll figure out a way to make that work for you. So I'm going to step back here and let Hannah talk a little bit about our case study, our patient, and give some information there as well.
Yes, well, I wanted to thank all of you for allowing us to come in and talk about hyperbarics and have Dr. Borson share that presentation. I was thinking about it during the presentation, and you guys are lucky to have had that, because I wish that we could have all of our patients kind of go over all of that information, and they do in the consultation, but you guys got the real scientific information involved in all of that. I wanted to we were introduced to this incredible group with one of our patients, Miss Linda Thomas, and we are so grateful to have her open this door of communication for us. Linda came to RxO2 hyperbaric clinics in early April of 2024, and at the time, hyperbaric oxygen therapy was a brand new concept for her, and to be completely transparent, IBM was also something new to us. But through Linda's journey, we've witnessed firsthand just how powerful the human body is when you give the right environment to heal. Like many of you, Linda has experienced a steady loss of function, but just in a few treatments, once her ears got a little bit more comfortable with the pressure, she began to notice meaningful changes in her daily life. One of the first breakthroughs came just after 13 treatments when Linda was able to do something she hadn't been able to do in 2 years, open a milk jug. That may sound like a small act, but we all know how huge those moments really are. After that, the progress started coming steadily. By treatment 34, she no longer needed 3 to 4 glasses of water to finish a meal. And today, at 100 and over 108 treatments completed, Linda continues to make strides and set new goals for herself. What stands out most is not only her progress, but her relentless determination to help others in this community. She has become a source of hope, a bridge between our clinic and those seeking answers, and a reminder that healing comes in many forms. We at RxO2 Hyperbaric Clinics are humbled to have played even a small role in her journey, and we're committed to continue to learn, grow, and support others with IBUM and myositis through research, collaboration, and patient-centered care. If anyone here has any questions about hyperbaric oxygen therapy, how it works, what a session is like, or how it might support someone with chronic inflammation or muscle degeneration, we're happy to help. Here and happy to help, sorry.
Yeah, so we're happy to answer any questions you guys have now. And if something comes up to you later, you guys have my contact, email us, text.
So you can unmute yourselves. I think most of you are muted during the call. So if you have any questions, you should be able to unmute yourself. You know, I've known Linda now for like a year and a half probably. And, you know, I kind of walked through this whole experience that she's gone through with a hyperbaric. And, you know, I would love to try it. And yet, you know, I know insurance typically doesn't cover it and it can be very pricey. And do you have any recommendations, you know, for people that may struggle a little bit with the financial end of it, you know, as far as maybe a slower, you know, fewer number of treatments or less duration, or, you know, I'm just curious if there's.
Yeah, absolutely. The financial question comes up obviously all the time because hyperbaric oxygen therapy does have a cost associated with it. You know, the chambers behind us, you know, about $150,000 each. We have to have quite a few of them. The chamber that we were showing you guys earlier for 6 patients, you know, $660,000 chamber. So there's a significant cost for centers on that. So if you were trying to figure out how we can get somewhere where we can get more reasonable care initially, so you're going to want to make sure whatever center you do find, again, has to have FDA approved chambers. Every incident that we've seen, with the exception of one, recently have all been in chambers that came in from Turkey or China. So be very, very careful. It's not worth risking your life over saving the cost on that. The other part of it is insurance does not cover this for IBM. However, we find people getting more insurance reimbursement for off-label indications we've ever seen before. So my recommendation would be absolutely submit to insurance and see what they say. You know, let's not just take it and say they won't cover it. Let's be the squeaky wheel to try to get that grease. I have a patient here who's had 200 or 300 treatments now covered for something that's completely off-label. And then we had another gentleman came in for cognitive decline. He was really unhappy that his Medicare only covered 70% of the cost. I was like, well, I think you did better than most. So as far as frequency, duration, you know, total number of treatments, always make sure your frequency is daily. So if you say, hey, I can commit to 5 treatments total, that's what my financial ability allows, 5 treatments in a row. Don't try to say, I'm going to try 2 a week and see what it's like. It's like, yeah, let's go to the gym. I'm going to work out once a month and I'm going to come back later and say, well, the gym doesn't work. Nothing happened. Well, the same thing will happen with hyperbaric. In fact, there could be a negative effect from infrequent treatment, too much oxidative stress. We'll go over how that works with everybody. As far as duration, you're never going to treat less than 60 minutes. There's not a protocol that's for less than 60 minutes. Now, how about getting foundations involved? We work with a number of foundations that pay for treatment for, children with disabilities, first responders, otherwise. And you might be surprised that there are foundations out there willing to help. We had a hiking association, the K2 Foundation, pay for somebody that had nothing to do with hiking or otherwise. They reached out, they said, hey, we have the ability to help, and they pay for 20 treatments for somebody that had nothing to do with that. So my recommendation is the squeaky wheel gets the grease. So I wish we could do more on our side to help. We do have 2 locations. Our Glendale location is more reasonably priced than our Scottsdale location. It's been open for 19 years. Our cost of doing business over there is significantly more reasonable. So if you're coming to us in Glendale.
Okay, thank you.
I have
Yes.
I have a quick question. Dr. Borson, I'm curious about that one anecdotal report of hyperbaric oxygen benefiting a patient. That was from back in 2012, and I can find no other reports since that time, which I find curious because I'm not a big fan of single reports. I've gone to lectures by the leading researchers in the area of inclusion body myositis. I've talked to them individually at times. I've never once heard anyone suggest in that realm that hyperbaric oxygen might be a benefit, or have heard a theory of why it might be of benefit.
Yeah. So I'm right there with you. A case report is really not helpful overall. A case report should lead to a case study, should lead to a double-blinded randomized control study. It's a funding issue. If an association gets together and is willing to pay for the funding, the research will happen. We are happy to do research in our facilities. And if we could get enough people together, and of course, IBM is, I'm looking at a large number of people with it right here, right now. However, like I mentioned at the very beginning, knew nothing about it in my career prior to this. There's not a significant number of patients. I mean, there are, but there's not, there's not enough that probably companies are looking at doing the research. So I wish I could say that these researchers were knocking my door and asking us to do the studies. I'm on a number of boards and I could get those studies right out in front of people. So why don't we connect? You've got my email. If you're in contact with people who are leading researchers in IBUM, I'll provide the ability for them to do their research in our facilities. We'll be able to cut down costs significantly for them for studies, to do that.
I would guess there would have to be a compelling enough reason for people to invest in this. I mean, for example, there have been and currently are clinical trials looking at pharmacologic agents trying to modify inclusion body myositis. So it is possible to recruit patients. It is possible to find the funding for that. But yeah, I've never once come across anyone in the area of IBM research who has talked about hyperbaric oxygen. The other question I had is for Linda. Are you getting functional tests, objective tests from your neurologist before and after the hyperbaric treatments?
Absolutely. Am I muted? Maybe no.
No,
I can hear you.
Oh yeah, absolutely. I go to Dr. Hatch at the Neurology Clinic for Honor Health, and she holds a clinic where you go every 3 months, and all of the other kinds of doctors and physical therapists and all of that, they all come through the room and they measure everything every 3 months. And I'm involved in the informational study at Irvine, California, where 2 times a year they do all these measurements. They're the ones that are trying to find a common denominator. So it's not like a study they're going to say, and I don't get the information unless I remember what they say. But yes, I take my blood test to Dr. Borsan, and we look them over because, I mean, I'm sure most of you guys know there's indications in your blood work that say whether you're got higher inflammation now than you had the last time you had that test.
And so that's why I'm pulling up here. I'm pulling up your chart to look over.
Well, I was more interested in the functional tests in terms of
Cognitive.
muscle strength
Yeah.
and flexibility.
Well, I certainly have, I've done, they do those when I go to these clinics that, the ones where they make you hold your arms out and
Yeah.
they push them down. Those are all now measured on devices, and I am improving.
Well, that's good to hear.
So I wanted to offer a different story. First of all, I want to thank Linda for pointing me toward hyperbaric oxygen therapy. I first chatted with her maybe 8 months ago. And I myself went through a treatment of like 30 sessions. I had at an hour and a half at 2.4 atmospheres. And I also had 2 platelet-rich plasma treatments and 12 glutathione infusions all over a 6-week period. And for me, unfortunately, there was no significant improvement. And I don't know why that is. The stories I've heard of successes seem to all involve females, and I don't know if there's something hormonal or if it's a different body mass or if I'm just too far advanced. I don't know what the issue was, but I felt the level of care was excellent. It just didn't work for me.
Okay,
Well,
can
I think
quick
it's important.
Sorry, I just want to ask a quick question. So 2.4 ATA, pretty high. Do they do that because they weren't using 100% oxygen? Do you know?
Well, it was 20 minutes on, then a 5-minute air break.
Okay, yeah.
Another 20 minutes, 5 minutes, 20 and 5, and then 15, and then
Yeah.
up.
And those air brakes are used to help increase growth factor release. It's a little bit of that hyperoxic hypoxic paradox that we talked about with HIF1 and alpha. But so 2.4 probably wouldn't be a protocol I'd typically put somebody on to get into soft tissue like that. That's a wound care protocol or getting into bone at that point.